Hello, good evening, everybody. I'm Dr. Mahesh from Sri Krishna National Medical Institute of Medical Sciences, an interventional cardiologist. Today, I'm speaking about the understanding of the hypertension. What is hypertension, and what happens if the blood pressure rises? The thing is, the hypertension is the one of the common disease. It is a disease, or it is a part of the life. Where our today's discussion will be on the high blood pressure. Blood pressure is nothing but the pressure exerted by the blood flow on the lateral wall of the blood vessel. So, to maintain the proper flow of the blood, the patient needs the heart to have to maintain some pressure. So, it has two pressures. One is systemic pressure, other is the pulmonary pressure. What we see commonly is the systemic pressure. So, what we did call routinely as the 120 by 80. So, whenever we are talking about hypertension, means most of the time it is the systemic pressure. So generally, everyone would like to have a healthy and a normal blood pressure. So basically, each time when the heart beats, it comes the blood into the blood vessels, and it will lead to the generate some pressures. Normally, in a healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer time and left untreated, and it may lead to some complications like stroke and paralysis and the heart attack. A high blood pressure usually develops over time. It can happen because of the unhealthy lifestyle choice. For example, not having enough regular physical activity and obesity and smoking and a high alcohol consumption and stress. There are other risk factors that also increase the that also increase the risk of the developing hypertension. These are all age. As people get ages, the arteries can stiffen up and it will narrow and it may lead to the buildup of the excess pressures. Family history of high blood pressure. So one or more close family members with the hypertension increase the person risk for the developing hypertension over the life. So these are some fixed risk factors. Suppose age, you can add 0.5. Suppose as routinely as the patient gets ages, the pressure rises little bit. And maybe it may not go too high. If it is go too high, you have to treat. And family risk also it is also a fixed risk. Suppose you cannot change the paradigm like family members. So family is a genetic problem. So the patients with having the family history, you have to identify early and you have to take the measures and advise them proper healthy lifestyles to make them to maintain the blood pressure. Excess salt intake is also known to raise the blood pressures. Not eating enough foods with potassium can increase the blood pressure and the risk of stroke and chronic diseases. Eating processed and fatty foods increase fat throughout the body and make the heart work and harder to push the blood through the blood, hence causing blood pressure to rise. On the other hand, lack of physical activity also linked to the obesity and may lead to the high blood pressure. Developing blood pressure may be due to lifestyle modification. So the patients who are most of the time sitting and not doing enough activities, these people may get checked like that they have increased obesity and may develop increased stiffness or whether, and these people may also develop hypertension. Another one is the stress. So daily regular activities in patients with having some stress like react to stress in unhealthy ways or not managing stress properly can also increase the blood pressures. So these are all the various causes. Some are fixed, some are modified. Fixed one is where you cannot change that one because it happens because of the genetic, it happens because of your age. Modifiable one, which we can change, suppose increasing taking of the salt and taking some processed foods and obesity, what we can manage with the exercise, we can reduce the obesity. All these things that can be modified. So moving on, hypertension doesn't have any obvious signs and symptoms, which is why it is often called as a silent killer. It puts people at a risk for several disorders, from cardiovascular problems to kidney failures, stroke, and eye damage and blindness. Hence, early accurate diagnosis is very important. Once the damage occurs, we cannot take. So once the kidney is failed, so we have to take other measures to maintain the kidney properly, like dialysis, all those things you have to do. So you have to intervene the hypertension before it causes some problems to the person, some problems to the health. So whenever there is a high blood pressure, you have to make an immediate noting, and you have to take the proper medication or lifestyle modification. Hence, early and accurate diagnosis is very important in the management of hypertension. And measuring the blood pressure is the only way to know whether the person is having high blood pressure or not. So, instead of getting into the problems, check it regularly. And if it is a high blood pressure, take proper drugs. Generally, when symptoms do occur, they include morning headaches, tiredness, vision changes, buzzing in the head, fatigue, nausea, vomiting. If persons are experiencing some of these symptoms, then one should get their blood pressure checks. There are some vague symptoms. We cannot completely assign them to the blood pressure itself. Symptoms can occur even with other problems also. Suppose if the patient is having some basic set of symptoms, we will ask them to get a check your blood pressure. If blood pressure is high, we can check therapy. Fortunately, high pressures can be easily diagnosed. Your blood pressure is one of the easiest and simplest diagnostic tools, and is by doing with the current and possible future health. So it is usually measured with the instrument called the sphygmomanometer and blood pressure monitors. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand. A healthy and normal person will have blood pressure around 120 by 80. That is it's already 120 or 80. Here, the upper number indicates the systolic pressure and the lower number indicates the diastolic pressure. So when the heart contracts, whereas the lower number indicates a diastolic pressure, means the pressure in the blood vessels when the heart rests between the beats. If the blood pressure levels are more than 140 by 90, so systolic is more than 140 and diastolic is more than 90, then the person is having hypertension. If the persons have BP levels higher than this, then she might be risk for the developing a serious heart disease. So to prevent this one, we have to ask the patient go for the lifestyle modification and drugs. Lifestyle modification like regular exercise, healthy diet like that, taking low salt diet between having fresh fruits, vegetables, and low fat diets, and quite quit smoking, regular blood pressure monitoring, and stress management, and adherence to medicine. These are all the main things which will helps to control the pressures. If a blood pressure is successfully controlled, such type of modification, then it may about delay and reduce the need for medication. So let us take one of these strategies one by one. Regular exercise. What is that one? Exercise that can be drug-free approach to lowering high blood pressure. Regular physical activity makes person heart stronger. If one have a strong healthy heart, it can pump the more blood and it can pump more or less with less effort. So the heart has to work less to pump, the force on the blood pressure will be less and the pressure will be less. In other aware of that, the gain and two major factors for high BP. So if the blood pressure is at a desirable levels, that is less than 120 by 80, then exercise can help to prevent it. Regular exercise can also help you to maintain a healthy weight, which is, by opinion, is an important way to control the blood pressure. One should aim for at least 30 minutes of the aerobic activity most of the days. High BP levels can be reduced by doing regular structured exercise such as brisk walking, jogging, and 30 minutes per day walking or jogging will reduce the blood pressure. A healthy diet. What is healthy diet? The diet is also plays important roles in controlling the blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for the hypertensive patients for lowering blood pressures and preventing hypertension. A DASH diet or a Mediterranean diet, eating less saturated fats, our total fat, and getting plenty of potassium and limiting the amount of sodium in the diet or the limiting alcohol consumption. A DASH diet stands for the dietary approach to stop hypertension and diet. Eating DASH diet that is rich in whole grains, fruits, vegetables is good for the health and it will reduce the blood pressure of around 11 millimeters of mercury. And reduce sodium in the diet. The sodium levels in the diet will also increase your blood pressure. So taking around less than 1 tablespoon, around 2 grams sodium is sufficient. More than that will may cause to increase the blood pressure. So avoid taking the more salt. And read food labels if you are taking any food, look the food labels and check their sodium content and fats and saturated unsaturated fats, and eating having the healthy diet is very important. Don't add salt, that is more than that one. Quit smoking. So smoking is also the one of the risk factors for developing hypertension. So quitting smoking and stopping smoking will reduce the blood pressure and will reduce atherosclerosis also. And taking the regular blood pressure monitoring. So you take the regular precautions and all those things. So you have to check your pressures regularly, like every month or every week, like that. So it depends on the periodic intervals, like that. Self-monitoring helps to measure the BP at different times throughout the day and over a longer period of time. It also assists doctor to get more complete picture of person blood pressure and reading the different times and further steps. Stress management. This is also one of the important factor which occurs because of the work and because of health and family problems. This can be managed by developing less stress by doing yoga, something like that. And adherence to medication. So after all those things, if the blood pressure is not controlled, you have to take down regular drugs which are prescribed by the doctor, and taking the drugs regularly and taking at regular intervals and maintaining the proper compliance of the drugs is also important. So if you take the drugs properly and sometimes if you stop the drugs again, there is a rebound hypertension and there is a more complications. So it is always better to take regular medication. So one other thing, hypertension, you have to, only thing is that it's nothing. The simplest disease to manage. Only thing you have to check it regularly and you have to adopt healthy lifestyles. If it is not controlled by lifestyle modification, then you have to take medication that will be at regular levels and good compliance is important.